If we look in the left ventricle, we can see that this is quite a small ventricular cavity. There's marked endocardial fibroelastosis here. You see the marked thickening of the endocardial layer here and here. There is fibrosis of the papillary muscles as well. The endocardial fibrosis extends onto the papillary muscles as well as onto the mitral valve leaflets. Here you can see this posterior leaflet is quite thickened with this fibroelastotic process. The anterior leaflet is somewhat thickened but not quite as severely involved as the posterior leaflet. There are two papillary muscles here that are relatively closely spaced, resulting in a small mitral valve commensurate with the size of the ventricular cavity. If we examine the left ventricle in this patient, you can see that it's really quite small with marked endocardial fibroelastosis. Nonetheless, this patient was able to survive 3 months with this as the systemic ventricle. The ductus is closed. The mitral valve is also quite abnormal. You can see the anterior leaflet here with an excrescence here on the mid part of the leaflet, nodular myxomatous posterior leaflet here in the back, closely spaced papillary muscles but commensurate with the size of this left ventricle. And notice that there's marked endocardial fibrosis that involves the papillary muscles and extends up onto the leaflet of the mitral valve. So despite the tiny size of this ventricle, the quite abnormal mitral valve and aortic valves, this patient was able to survive 3 months. Left ventricle shows endocardial fibroelastosis. You can see the thick fibrous endocardium here extending out into the myocardium. There is substantial left ventricular hypertrophy, increased wall thickness that you can see here toward the septum. We can again see endocardial fibrosis that's even more marked at the apex. The papillary muscles have rather thin heads as they attach to the mitral valve. Again, this is from ischemia and fibrosis of the tips of the papillary muscle heads. The left ventricular outflow tract below the valve is unobstructed, so there's no subaortic stenosis, just valvar aortic stenosis in this case. The mitral valve itself is rather normal in appearance. The leaflets are relatively thin. There are intercordal spaces and normal chordal arrangements attaching to the papillary muscles. This patient with critical aortic stenosis has an adequate left ventricle. We can see that the ventricle forms the apex of the heart. There's minimal endocardial fibrosis. The endocardial surface here looks like myocardium, so we don't see the thick endocardial fibrosis that we've seen in other specimens. The left ventricular papillary muscles look relatively normal here. There's mild thinning of this one, but the posteromedial muscle looks quite normal. The mitral valve in this case also has a normal morphology. The anterior leaflet here, posterior leaflet in the back. There are reasonably well-spaced papillary muscles and normal leaflet tissue of the mitral valve. The mitral valve has a characteristic morphology that was called by Dr. Jesse Edwards an arcade mitral valve because it reminded him of the architectural feature on the side of buildings. You can see the thin papillary muscles here with fibrosis of the tip of the papillary muscle. The free edge of the anterior leaflet of the mitral valve is a fibrous cord that extends from the anterolateral papillary muscle to the posteromedial muscle, forming the arch of the arcade, and the papillary muscles themselves form the columns that support the arch on either side. So this is the typical appearance of an arcade-type mitral valve. Here there are a couple of small intercordal spaces here, but otherwise the leaflets are relatively solid straight across, and there's direct insertion into the papillary muscle heads.